A very good morning to one and all. On behalf of Department of Periodontology, Saraswati Dental College, Lucknow, I, Dr. Ruchi Srivastav, welcome you all once again in this lecture series of Perioshastra 2021. I take the privilege to introduce and welcome our guest speaker of the day, Dr. Shipra Gupta ma'am. Dr. Shipra has done her graduation and post-graduation from Government Dental College and Hospital, Patiala, Punjab. During her graduation, she was awarded as the best graduate of her batch and also awarded the University Merit Certificate and Medal by Punjabi University. She has over 20 academic medals to her credit. She is a life member of Indian Society of Periodontology. She has also been executive committee member of ISP since 2011 and is presently holding the post of scientific program convener. She has over 50 publications in various national and international journals and has presented scientific papers at state and national level conferences. Her team has been working diligently in the field of COVID-19 perio connection since 2020. With over 7 COVID-19 related publications in print and more under various stages of publication and review, her team has presented the most comprehensive work in this field. Presently, she is working as assistant professor at PGI Chandigarh. I would now like to invite Dr. Shipra Gupta ma'am for her presentation on COVID-19 and periodontitis, the journey so far. So we welcome you, ma'am.
Thank you, Dr. Ruchi. Thank you for having me here. Can I start sharing my screen?
Yes, ma'am, you can share your screen.
Is the screen visible, Dr. Ruchi?
Yes, ma'am, we can see it.
Okay. I kindly request all the viewers to mute their laptops so that the voice is clear. Okay. Morning, everyone. I'm Dr. Shipra, working at PGI Chandigarh, and today I will be talking on COVID-19 and periodontitis, the journey so far. And I can proudly say that a major chunk of whatever I will show next is a part of what our team has done. So COVID-19 pandemic presented a conundrum like never before in terms of understanding its pathophysiology. It's not moving ahead. Just a minute. Okay. So the first cases that turned up in Wuhan in China in December 2019. Outside of China, the first case was recorded in Thailand in January 2020, and in India, the first case was reported in Kerala on 27th January in a 20-year-old female. On 30th January, WHO termed COVID-19 a global pandemic. Just a little bit about the SARS-CoV-2 virus. So this is a beta coronavirus. It is a single-strand RNA virus. WHO declared 4 variants of concern: Alpha, Beta, Gamma, and Delta. The Delta lineage emerged in India in October 2020. Common symptoms are fever, fatigue, dry cough, myalgia, dyspnea, diarrhea, nausea, vomiting. And the onset of this disease could lead to progressive respiratory failure because of damage to the lungs and even death. So with no cure in sight, it was of utmost importance to identify the factors which may alter the course of this disease in order to aid in its understanding and subsequent management. Just let me minimize this. As we all know, periodontal disease is a pandemic in itself, with the caseload far exceeding that of COVID-19. So when this disease came, COVID-19 came, we were really concerned, and it struck our minds whether there is an association between the two diseases, between COVID-19 and periodontal health and disease. There are certain diagnostic links which might point towards this probable association. So these mechanistic links I'll be talking about in three parts. I'll be telling you a little bit about the SARS-CoV-2 virus, a little bit about the ACE2 receptors, and our own periopathogens. Coming to the structure of the SARS-CoV-2 virus, this virus has a diameter of 50 to 20 nanometers. There are four structural proteins known as the spike protein, envelope protein, membrane protein, and the nucleocapsid protein. ये जो सेम है spike, envelope, and membrane, they create viral envelope, and the M protein holds the RNA genome. Now, this spike protein is of a lot of interest to us. It is now divided S1 and S2. Have a look at the structure. This is the nucleocapsid, the spike protein, the membrane protein, and the envelope protein. This is the structure of the spike protein, and this is of interest to us. This spike protein, I request to kindly mute their mics. Thank you. So the spike protein has two subunits. The S1 subunit, which is primarily responsible for the fusion, for the receptor binding. It has this receptor binding domain. And the S2 subunit, which is responsible for the fusion. So this SARS-CoV-2 virus has a cleavage site at this S1, S2 furin cleavage site is there, and there is a S2 cleavage site. These two cleavages are important for the priming of the S protein. Once the priming of the S protein occurs, the virus is able to attach to the host cell. It is able to fuse with the membrane of the host cell and release its RNA into the cytoplasm of the host cell, and so that replication can occur. So the fusion capacity of this virus is a leading indicator of infectivity of the virus. And for that fusion to occur, first these two cleavages need to occur. And this cleavage site, which I talked about, furin cleavage site, is absent in SARS-CoV virus. And this furin cleavage site is essential for the zoonotic transfer to humans. So as this particular virus has acquired this furin cleavage site, it was able to spread from human to human population. After SARS-CoV-2, let's talk a little bit about the ACE2 receptor. You all must have read about ACE2 receptor in the last few days, in the last few months. So now this ACE2 receptor, it plays a crucial role in the viral cellular entry of the virus. The receptor binding domain of SARS-CoV-2 virus has approximately 10 to 20-fold higher affinity for ACE2 than simple SARS-CoV virus. And that means कि जहां पे भी ACE2 receptor ज़्यादा होगा, वहां पे viral entry can occur at a faster speed. कहाँ ज़्यादा होता है? It is more in the alveolar cells of the lungs, in the esophagus, ileum, colon, myocardial cells, kidney cells, and the urothelial cell. So any organ with high ACE2 expression will have a higher potential for SARS-CoV-2 infection. Zhu et al. In 2020 did a study on the ACE2 receptors in oral mucosa, and they found in their study that a high expression of ACE2 is there in the mucosa of the oral cavity, especially in the epithelial cells of the tongue, followed by buccal mucosa and gingiva. Another study which was published this year by Huang et al., they have found that ACE2 receptors are also present in the salivary glands, especially in the minor salivary glands. Rather than parotid glands, minor salivary glands में ACE2 receptors का expression ज़्यादा रहता है, and there is a positive correlation between the salivary viral load and taste loss. This study also gave a few very interesting findings. They said that in comparison to an symptomatic individual, asymptomatic individual में around 1 week later तक viral shedding होता रहता है. And compared to a nasopharyngeal swab, NPS में the person may come negative, but the saliva of that person keeps shedding the virus for 1 week more. So what we can understand from this is that the asymptomatic individuals are the Achilles heel of this particular infection. एक asymptomatic individual for a longer period compared to a symptomatic individual will keep shedding the virus. And अगर वो NPS पे negative भी आ जाता है, तो भी उसका saliva for 1 week more will be shedding the viral RNA. Okay, so asymptomatic individuals को catch करना, उनका viral load करना becomes extremely important. Then our oral pathogens also, we know, we all study periosystemic interconnect, hum padhte hain, and we know that oral pathogens, by virtue of their own aspiration into the lungs, they can increase the progression of the respiratory diseases, or they can release enzymes which can modify the mucosal surfaces to allow for adhesion and colonization of the respiratory pathogens, or they can also release certain cytokines. Okay, exaggerated response with the cytokines release hote hain, which can again exaggerate the the respiratory diseases. So by virtue of all these mechanistic links, SARS-CoV virus का spike protein कुछ ऐसा है, उसका affinity with ACE2 receptor कुछ ऐसा है, and our own periopathogens are also playing a role in the pathogenesis of respiratory infection. All these things play a role, and hence somewhere our oral cavity, the oral health could be related to COVID-19. So this is how our journey started. With all these points in mind, our journey started. So the first article our team published was in Medical Hypothesis Journal. We worked on this article as early as May 2020. And this article has been already cited 45 times. And it was on the connection between the COVID-19 and periodontal disease through the cytokine connection. All the studies which I will be showing in my presentation, if they have this picture of this virus on that PPT, that means that is our work. I've quoted other authors also, but wherever I'm presenting my work, I have posted this picture of this particular virus here. So in this article, we know that increased cytokines are there in patients who have gingivitis and periodontitis. Okay, cytokines बढ़ जाते हैं if you have gingivitis or periodontitis. And these cytokine levels are also mirroring the cytokine levels in the systemic circulation. So GCF में cytokine levels is mirroring the cytokine levels in serum also. If you do periodontal therapy, we also know कि जो cytokine levels है वो reduce हो जाते हैं. Now in COVID-19, you must have heard the term cytokine storm. That is, in this COVID-19 disease, also the cytokines are increased. IL-1 beta, 7, 10, 17, 2, 19, 9, 8, TNF alpha, interferon gamma, and all these cytokines are increased. And a few of these cytokines, if they are increased, the patient has more exaggerated symptoms of COVID-19. ICU admission bhi chahiye ho sakta hai, death bhi ho sakti hai. This is now known to us. So that means there might be a common pathway. अगर हमारी periodontal disease में cytokines increased है, that means they might contribute to the adverse outcomes of COVID-19. So this is the first hypothesis we gave in 2020 in this connection. Then another of our own articles, the second hypothesis we published was on the possibility of increased level of nets in both diseases. Again, it has been published in Medical Hypothesis Journal. So what are nets? Basically, neutrophil extracellular traps is an alternate form of cell death. It is different from necrosis and it is different from apoptosis. It is an attempt of the body to contain and eliminate the insult. In this, nets क्या होते हैं? It is basically nuclear chromatin in a web-like configuration. Okay. So it is able to eliminate the insult, but along with the insult getting eliminated, there is resultant cell death. And because of this, there is bystander damage either directly or through autoimmune mechanism. Now, these nets have been found in periodontal disease patients also, and these nets have also been found in the bronchoalveolar lavage of the COVID-19 patients. Hence, we had given this hypothesis that if the nets in the periodontal disease might contribute to the adverse outcomes of COVID-19. This is not directly related to COVID-19, but another of our works. When COVID-19 came, everybody was trying to do something to make dentistry safer. So we also did a 2-bit, and we came up with an aerosol box for dentistry. It was a modified design, and it has 2 circular ports on the 9 o'clock position, 12 o'clock position, and 1 port on the 3 o'clock position, and a hole on the top of the box. So you could attach a suction device, to catch the droplets in the hood. Then it had an arch or a hinge-like mechanism so that the patient could get up from the chair could get up and spit in the spittoon without you having to remove the aerosol box every time the patient gets up to spit. So this was published in the British Dental Journal. Okay, so after the mechanistic links and the hypothesis, now I will be talking about the SARS-CoV-2 detection in different oral samples. This is a study. This was a landmark study. This was the first study in the world to detect this virus in gingival clavicular fluid, and it has been published in Journal of Dental Research. So in this study, we collected the GCF and saliva sample from 33 COVID-19 patients, and along with the NPS, and we found that keeping NPS as the gold standard in the nasopharyngeal swabs. So keeping nasopharyngeal swabs as the gold standard, found, I request the viewers to kindly mute their mics. Thank you. So keeping the NPS swabs as a gold standard, the sensitivity of GCF was found to be 63.64%, and that of saliva was 64.52%. That is, GCF and saliva were comparable in terms of their sensitivity to detect the SARS-CoV-2 virus. And we found a significant difference of 69 mean CT values. CT values are cycle threshold values. From NPS. For example, if the patient had a CT value of 18 or 19 in NPS, the corresponding GCF value would be around 24, 25, and saliva also similarly. So this was the first study to detect the virus in gingival clavicular fluid, and hence we could state that any procedure, like be it ultrasonic scaling, be it any procedure being performed without a rubber dam, would hence expose the dental healthcare professional to GCF and saliva and pose a risk for infection transfer. So here you can see the p-value for GCF and saliva showing they were comparable in their sensitivities. And the mean CT value for nasopharyngeal swabs was 21. And here you can see the mean CT value of NPS swabs. GCF वालों का 6 to 8 values ज़्यादा था. Similarly for saliva. So out of 33 patients, 21 patients tested positive in GCF, and out of 2 of the saliva samples were lost. So out of 31 samples, 20 patients का saliva भी positive था. And we were fortunate that this study won us the first prize at the 8th Annual Research Day held at PGI on 22nd October, just last month. So this study had the maximum impact factor and the citations in all the surgical specialties, not only oral health. I'm talking about eye, ENT, orthopedics, pediatric surgery, general surgery, obs and gynae. So un sab mein we got the first prize. We were very fortunate, and it was covered widely in the newspapers. And this is our head, Dr. Gaba sir, head of the dental department at PGI, head of director PGI, Dr. Jagatram sir, my research scholar, Dr. Kanksha, and my senior resident, Dr. Mohita. So it has been a team effort, and everybody has worked really hard. In other of our studies following GCF, side by side, we were working on buccal swabs, being non-invasive specimens for the detection of this particular virus. This article was published in Journal of International Medical Research. And similarly, we collected the buccal swabs and saliva of 73 patients, and the samples were sent in a cold chain to the Department of Virology for RT-PCR, and we could detect the viral RNA. So keeping the NPS samples as positive, as gold standard, the sensitivity of buccal swabs was found to be 58.9%. So best was NPS, followed by saliva, followed by the buccal swabs. So buccal swabs could be utilized in patients like geriatric patients, pediatric patients, जिनको uncomfortable है. Then this is a non-invasive method. इसमें aerosol generation नहीं है, ये self-collected swabs थे, patient ने खुद collect किए थे, है ना? Then there are certain situations where nasopharyngeal swab technique is not possible or difficult. It is a very difficult procedure अगर आपने कराया हो. It is quite troublesome. हाँ. प्लस पेशेंट के किसी के डिविएटेड नेजल सेप्टम हो, ट्रिस्मस हो, कोई और प्रॉब्लम हो, तो आप उन केसेस के अंदर बकल स्वैब भी ट्राई कर सकते हैं. So this was a study, and these are the paired samples. This is the mean CT value for nasopharyngeal swabs, buccal swabs, and saliva. This article was also covered widely by several newspapers. Then Badran et al. have they published a hypothesis in the Medical Hypothesis Journal stating that periodontal pockets could be a favorable anatomical niche for the virus. Okay, so it has already been seen like आपका herpes simplex virus है, Epstein virus है, cytomegalovirus है. They've already been found in periodontal pockets. So similarly, SARS-CoV-2 virus could also be finding a place and staying in the periodontal pockets. वहां से it could enter the oral cavity, it could mix with the saliva, it could even migrate systemically using the capillary periodontal complex. So this is what they had hypothesized. Then this was a post-mortem study conducted by Martek et al. In 2020. It has been published in 2020. Yeah. So they made an incision in the body bag of the dead patients, 7 dead patients, and using a video endoscope, they found a minimally invasive biopsy. Smartphone be used किया इन्होंने, and they went to the interdental tissue of the maxillary first molar using this endoscope. Maxillary first molar said they took a tissue of the periodontal interdental area and they sent it to PCR. So out of 7 cases, 5 they could detect the SARS-CoV-2 virus. And on the histopathological analysis of the keratinocytes of the junctional epithelium, they also found vacuolization around the cytoplasm and a little bit of nuclear pleomorphism. But this was not related to oral changes being occurring due to COVID. This was because of the feeding tubes, enteric tubes and all, which had been put, not because of the COVID. COVID was not causing any such changes in the tissues. Then this study has been published in 2021 recently. And in this study, Gomez et al., among the 70 participants, 70 COVID positive cases, 13 के अंदर they collected the plaque of patients and 13 में plaque में जो आपका है virus was positive. So plaque had a sensitivity of 18.6%. Then another study to detect the virus in calculus has been done, dental calculus. So once the patients had recovered from COVID, 2 months after that, this particular group of researchers, they took 5 patients who were positive for COVID. 2 months earlier, they had been positive for COVID. And 2 were suspected individuals who had mild symptoms, but on NPS, they were found to be negative. And 5 were healthy controls, jinka NPS bhi negative tha, and who were denied contact with positive subjects. So in these 12 patients, they took the calculus and sent it for RT-PCR. And they found that all 5 positive patients में the virus was there in the calculus. दोनों suspected patients में भी virus was there in the calculus. And out of the 5 control patients, 1 patient had the virus in his calculus. So they said that dental calculus might be helpful to detect the SARS-CoV-2 virus traces in previously infected or asymptomatic individuals. तो calculus में भी virus मिला है, plaque में भी मिला है, periodontal tissue में भी मिला है, GCF में भी मिला है, buccal swabs में भी मिला है. So we've been able to find the virus in all these fluids. Now this is our own work, which is under review at Journal of Clinical Periodontology. So JCP में review चल रहा है. This in this we have tried to find the virus in the toothbrushes. Okay. See, toothbrushing with toothpaste is the most effective and recommended method for maintaining the oral hygiene. Theoretically, we know, when we started this study, we didn't know, but now we know that plaque mein hai, calculus mein hai, everywhere it is there, GCF saliva, everywhere it is there. So it must be in the toothbrushes also. Okay. But on the other hand, theoretically, when we apply the paste of the commercially available paste, it also has powerful detergents. So these powerful detergents could neutralize the virus. Okay. Then हो सकता है virus नहीं भी हो. So nobody knows, there's no scientific evidence to support or reject this theory. Now toothbrushes are a household item. Plus there are no scientifically backed recommendations as to what a patient should do with their toothbrush once they recover from COVID-19 or once the quarantine period is over. So after 10 days, the patients, as per the Government of India guidelines, days was the quarantine period. Once the patients are joining back with their families and उनका store इकट्ठा हो रहा है brush with their family members, what are they supposed to do with their toothbrush? Is it still retaining the virus or not? So we wanted to see this. In 28 COVID-19 positive patients, after getting the ethical clearance, we collected the after in 28 COVID-19 patients, we recalled the patients on day 5 and day 10. When they came on day 5, we checked their NPS, COVID status check here. We gave them new toothbrushes. We gave them and the patients brushed 2 minutes in the usual manner. And similarly on day 10. Okay. So once they had brushed, we cut the brush in this manner and we transported it into a vial containing 3 ml of viral transport medium. Now this will be request you to please mute your mics. These brushes were then transported in vials containing VTM, and the RT-PCR was done to detect the virus. So coming to the results, out of these 28 patients, these are the fifth day results. Out of these 28 patients, 23 were still positive on day 5 on NPS, and in 12 के brush heads में virus आपका positive आया. And on out of the 5 patients who tested negative, 1 of them had the virus in the brush head. Coming to day 10, 4 of the patients were lost due to follow-up. So we had 24 patients at day 10, out of which 14 were still positive. See, and patients are going back to their families, but they were still positive on the 10th day, and 10 were negative. In these 14 positive, 4 ka brush head was positive for the viral RNA, and none of the negative ones had virus. These are the mean CT values for the NPS and the brush head and the paired samples. So what we can now see is that SARS-CoV-2 was recovered from the toothbrush heads despite the presence of powerful detergents in the dentifrice. That means toothbrushes could be a potential vehicle for the spread of SARS-CoV-2 virus. So the patients who have completed their isolation periods to rejoin their families might still be shedding the virus, and if their toothbrushes are stored or shared with their family members, they might pass on the infection to them. In this study, we have now also recommended using toothbrushes as alternate sampling methodology for SARS-CoV-2 detection. We are conducting other studies also in which we have collected toothbrushes on the first day. And just off the records, 100% sensitivity aa raha hai toothbrush ka. All the patients we are testing on the first day, 100% of them are giving positive. And that is even after applying the toothpaste. So in case you want to use toothbrushes as sampling methodology, just give them the brush without the paste. तो वो और भी ज्यादा अच्छा result आएगा, है ना? And it is so much more cost effective, painless है, self collectible है, कोई technical skill नहीं चाहिए, कोई pain नहीं होगा, है ना? छोटे बच्चों में, geriatric patients में, anybody will be more comfortable with the toothbrush rather than an NPS swab. So these were all the studies which were finding the virus in whatever oral fluids. Now we will start talking about the studies which have worked on establishing an association between COVID-19 and periodontal health and disease. The first study I'm taking up is that of Maroof et al. In 2021, published in JCP. Now, Dr. Mariano Sanz was also a part of this study. So this was a case control study, and they collected the data from National Electronic Health Records. They had cases and controls. Controls were the patients जिनको COVID हो चुका है, discharge हो गए patients without any major complications, and cases COVID-19 ventilation. So I'm not sort of criticizing the study, but we should be aware of what they have done and what are the limitations of their study. So this study was based on the periodontal status was based on the bite wings and the panoramic radiographs from the patient's records. If the patient had visited the dentist 1 year earlier, any time within last year before getting COVID, because abroad mein you have the dental records, X-ray records are kept, saved hote hain. There is a proper registry. We don't save our dental records that way. It is not available to the dental public. But wahan pe proper, because of whatever insurance and all, the dental records are there with the team. So they just picked up the dental X-ray records of those patients And if there was interdental bone loss on the X-ray, they labeled it कि patient is of periodontitis. कि ठीक है, bone loss है तो periodontitis है, इतना है तो stage 1 है, 2 है, 3 है, 4 है. They did all the staging based on the X-rays taken 1 year back, without checking physically, actually checking the patients. Patient might have had एक साल पहले उसका oral health condition क्या था और अब क्या है, might be different. He may not be having active periodontal disease now. Anyways, this is what they did. And they also collected the blood and checked it for WBC, D-dimer, and CRP. And they found that periodontitis was associated with COVID-19 complications, with periodontitis patients having 8 times more chances of dying, 3.54 more chances of ICU admission, and 4.57 more chances of requiring assisted ventilation. After that, there was another study which has been published in Frontiers of Medicine. Now, they also did the same thing. There is a UK Biobank. The UK Biobank is a longitudinal study going on in UK of over 5 lakh patients. 2006 se chal rahi hai ye study. And the government of England, they opened it for everybody. Uska jo data hai ki, okay, at the time of COVID, whatever data you can find and, research you can come up with, and whatever is available, it was made freely available to all the researchers. And this particular group of researchers then worked on these patients on this data. And in that data, there were already a questionnaire on the oral health. They had asked 3 questions: whether you have pain in the gums, whether there was bleeding gums, or whether the teeth were loose. So these 3 cases, questions ke basis pe, they classified the patients as having mild periodontal disease if bleeding ya pain ka complaint tha, and severe periodontal disease if the patient complained of loose teeth. So these 3 oral health indicators were self-reported. They've not checked, not gone and checked the cases. Us biobank mein pehle hi data tha, and they just saw within March to June which of those patients became positive for COVID. Okay, और उनका उन्होंने data उठाया, and then they did this research. So according to them also, risk of if you have periodontal disease doesn't mean you will get the COVID-19 infection. That was first result. And the second result was that patients with painful or bleeding gums had a higher risk of mortality. Study ka result ye tha that if you have mild to multi-periodontal disease, you have a higher risk of mortality. However, the patient or mortality. Kindly mute the mics. Thank you. So this is our own study as evident by this virus here. And this article has been published in the Clinical Oral Investigations Journal in 2021. And it has been, when the study was published, it was widely covered by the newspapers. So in this study, we went several steps further and performed real-time clinical assessment of the patients. We went and checked each and every patient ourselves. And along with a comprehensive periodontal clinical examination, we also utilized validated active MMP8 point-of-care diagnostic kits to evaluate the presence of active periodontal disease. This was first such study in which each and every positive patient has been, physically checked. We have gone and checked ourselves, not dependent upon questionnaires or X-rays. So in this study, we recruited 82 patients which were reporting to the communicable disease ward or were admitted in the hospital, in the COVID hospital at PGI from January to February 2021. And we recorded the age, sex, smoking habits, and other COVID-related comorbidities. We carried out a comprehensive clinical examination. We also recorded blood parameters like HbA1c, CRP, D-dimer, BNP, ferritin, platelet count, hemoglobin, vitamin D3, troponin, procalcitonin, and NLR ratio. And we also carried out the assessment of active periodontal disease using MMP8 point-of-care diagnostic kits. These diagnostic kits I will be taking up a little bit later in detail. So D-dimer, we all know, is a sensitive marker for venous thromboembolism. ProBNP is a cardiac biomarker of reduced ventricular systolic function. Troponin is again a marker for myocardial infarct size. Procalcitonin is increased in patients with superadded bacterial infection. And NLR ratio is a marker for systemic inflammation. HbA1c increased levels are associated with hypercoagulability and low oxygen saturation and inflammation. CRP is an acute phase reactant, pro-inflammatory in nature. It's an early biomarker for triaging the severity of COVID-19 infections. Ferritin is an acute phase reactant and an indicator of systemic inflammation. And vitamin D3 decreases the risk of acute viral respiratory tract infections and pneumonia by direct and indirect inhibition of the viral replication. So all these were checked. And the outcome variables of our study was the need for assisted ventilation. If the person was comfortable on room air, he did not require assisted ventilation. However, if he required HNFC, NIV, or ventilator, we took it into the group of assisted ventilation. Similarly, hospital admission, we checked whether the patient was isolated at home or whether he had been admitted to the hospital ward or the ICU. The presence of COVID-19 pneumonia was checked and whether the patient survived. So coming to the results of our 72 patients, 48 were males, 34 females, 51 had the COVID signs and symptoms, 14 had ground glass opacities on their x-rays, 52.43% had one or more of the comorbidities like diabetes, hypertension, CKD, CVD, cancer, obesity, etc. And this is the classification according to the Tonetti's latest classification of their periodontal status, which we checked, went and checked. The proving death, CAL, everything was recorded. And these are the outcome variables. 53 of them required hospital admission, 30 required assisted ventilation, 22 had COVID-19 pneumonia, and 8 of our patients died. So coming to the results, I've skipped all the big tables. You can look at the articles for that. They're huge tables with all this data. But coming to the results, in case the patient had higher severity of periodontitis, there were 7.45 times more chances of him requiring assisted ventilation, 36.52 odds of requiring hospital admission, 4.42 odds of acquiring pneumonia, and 14.58 odds of death. Similarly, for the individual variables of like bleeding on probing recession, you can see the results here. As far as the blood parameters are concerned, so periodontitis groups had higher levels of D-dimer, and these D-dimers they were more chances of requiring assisted ventilation and having hospital admission. So similarly, the higher levels of procalcitonin, pro-BNP, troponin, HbA1c, CRP in the periodontitis groups also pointed towards this indirect relationship that periodontitis was indirectly affecting the worsening of the comorbidities. CVD वर्सन हो रहा है ना, डायबिटीज वर्सन हो रहा है. So associated जो patient में comorbidities है, उनको periodontal disease जो है might be worsening those comorbidities and hence indirectly affecting the adverse outcomes in COVID. MMP8 we'll talk later. So the findings of this present study established a direct association between periodontal disease and COVID-19 related outcomes, and the patients had a poorer chance of survival if they had periodontal disease. So this study was the first to conduct intraoral examination among potentially infectious patients. Then there is another study in which they have again used a questionnaire and the medical records and conducted on 308 Egyptian patients, and they evaluated the correlation between oral health, the recovery period, and the CRP values. So they said that the patient's poor oral health, unme recovery after COVID is significantly delayed. If a patient requires more than 6 weeks, they were labeled as delayed recovery. So if the patient's oral health is poor, uska recovery bhi thoda delayed dekha tha, along with higher CRP levels in those cases. Now, this is again an Indian study carried out in ESIC Hyderabad, conducted by Dr. Pradeep, 2021 mein published hua hai study. So what they did was 79 patients in ka test group tha. Once those 79 patients recovered from COVID after 17 days, then they enrolled them into their study and unka periodontal examination carry out kiya. And they simply said that they were the patients having mean PLAS score of more than 1 more chances to have COVID-19. So these plaque score, gingivitis, having severe periodontitis, more frequent in the COVID-19 patients. Okay, but here I would like to again, criticize, not criticize, but find a limitation to the study, that as we went and checked in each and patient ourselves, तो जो wards में patient हैं, जो ICU में patient हैं, they don't even know कि वो वहाँ कब से admitted हैं, कितने दिन हो गए, बाहर दिन है, रात है, उनको कुछ नहीं पता. And for the patients and for the doctors there, the oral health of the patient is the least of their concerns. Okay, so if a patient is admitted, I don't know how many of these patients were now admitted and how were at home. If they were at home, they would have been able to maintain their oral hygiene. But जो wards और ICU में admitted patients हैं, उनका they are just maintaining their oral health most places by using a swab of chlorhexidine, and they उसे clean कर देते हैं उनके teeth twice a day. और उनका oral health इतना poor हो जाएगा at the end of 17 days that whatever the situation was when they had become positive with COVID-19, and that once they have recovered from COVID-19 will be different. The periodontal health will be different. Then after the association studies, now we take up a very interesting topic, which is active matrix metalloproteinase point of care diagnostic kits in the COVID-19 pandemic. This is an interesting part. So this is me myself posing with the active diagnostic kits in my hand at NHE. We started our journey of this MMP8 point of care diagnostics by publishing a number of articles. And this was an invited review published in Expert Review of Proteomics. And we were very fortunate to have with us various international collaborators in this article. And the most prominent of them being Dr. Golub, who was the inventor of Periostat 20 mg doxycycline used for host modulation therapy. So he's one of the co-authors in this article with us. And in this, it's a huge review. You can go through. It's a long review. And I would just like to this point on doxycycline. So doxycycline also plays a role in the COVID-19 management by inhibiting the nuclear factor kappa beta, which in turn brings about direct inhibition of DPP4, which is one of the receptors the virus uses for entry. And hence low doxycycline, which is essential non-microbial, that is the Periostat, can also be used for the treatment of the COVID-19, as it can inhibit these receptors. We've also published a few more studies on MMP8. We have been working on this for quite some time now, and you can go through them. This is published in Diagnostics. This particular study has been published in the Journal of Clinical Periodontology. This particular study has been accepted for publication in CEDR. And this is a study which I will be presenting now, because this is directly related to the COVID-19 patients, and this is under review at CEDR. So what is MMP8? Let us first start with ye hai kya? So MMP8 is collagenase enzyme. Okay, so this is host-derived collagenase, which is capable of cleaving the type 1 collagen, okay, of the periodontal supporting tissues during both disease and health. Now MMP8 is derived from fibroblast, oral keratinocytes, and the PMNs of the diseased periodontium. Now, ये जो MMP8 है, ये हमारी body में, it is present in active and latent forms. However, our periopathogens like Treponema denticola can activate this latent form by direct proteolysis. Okay, अब ये जब active हो जाता है, this active MMP8 has a strong association with the periodontal status. It is better diagnostic accuracy for periodontal disease than its total forms. This active MMP8 has been found if this is high, that means patient ke active periodontal disease hai. Even before the clinical signs come, even before bleeding on probing comes, you can detect the presence of active periodontal disease using this enzyme. You can check the levels of this enzyme, and it is strongly associated with the periodontal status of the patient. And iski active MMP8 ki point of care diagnostic kits hai, which have a sensitivity of around 83%. Now, how is this MMP8 related to perio? Humne pad liya. Now, how is it related to this SARS-CoV virus? So MMP8s do play a role in enhancing early entry of this virus into the cell. They degrade the extracellular matrix and modify the immune response. They also cause increased vascular permeability with endothelial damage. So MMP8 are associated with periodontitis also, and also associated with COVID-19. Now we know that perio is also associated with COVID-19. So we wanted to validate these kits as screening tool for periodontitis. If we can identify periodontitis in uh, COVID-19 patients or in patients who might be at risk for COVID-19, and if we can improve the oral health of that patient, that means COVID-19 का adverse effects भी कम हो सकता है. So it is good for us to have any screening tool in hand by which, sitting at home, the patient can check his periodontal status. A layman can check his status, a medical practitioner can use, even a dentist can use. COVID-19, everything was on teledentistry. Physical OPDs were closed. So at that time, the patients can use these kits sitting at home and check. अगर उनको लगता है कि MMP8 kit positive आया है, that means their periodontal status is not okay. So they can start improving it. In this study, after the ethical clearance, we recruited 102 COVID-19 suspected cases. 72 turned out to be positive in NPS, 30 were controls. They were negative, they were kept as controls. And in these 72, all these 102 patients, we checked all those covariates, सारा कुछ हमने history वगैरह record किया. We did the periodontal examination, and we carried out two types of MMP8 kits. One of the kits is based on a mouth rinse, and the other kit is based on GCF. Okay. And in the COVID-19 positive cases, we ran these kits once they turned negative after 17 days. So once the patients were negative, NPS से negative आ गए थे, हमने kits फिर से उनमें run की. So we recorded their data, periodontal examination, and we ran both these kits. So this is how these kits look like. ये PerioSafe है. This is a mouth rinse based kit. इसके अंदर एक fluid देते हैं, and you have this cup. So you put this fluid into this cup, give it to the patient to swish for 30 seconds. After that, you take the syringe, attach the filter. This is the filter given along with this is the filter, and take 2 to 3 drops of this fluid and put it in this card here. There's a well here. यहाँ पर डालना है. So these kits look exactly like your pregnancy test kits. जैसे pregnancy test kit होती है, बिल्कुल same है, and वैसे ही 1 line or 2 line का result आएगा. These are the GCF based kits. Immuno implant safe hai inka naam. You can use them for GCF around the natural teeth or for the PICF around the implants. So yeah, these are the two GCF record करने के लिए strips है, GCF collection strips दिए. You place them in the deepest pocket, and after 30 seconds, you place these strips into the elution fluid given here. You turn करना पड़ता है bottle को 10 times. फिर ये डिपस्टिक दी हुई है. डिपस्टिक जो है with its yellow zone facing downwards, stand in this bottle, and once the fluid has risen in the dipstick, you place it on a horizontal surface for 5 minutes. So in both of these kits, the results are at exactly 5 minutes. So just like a pregnancy test kit, one single line means negative. Negative means कि MMP8 levels जो है आपके 20 nanogram per ml से कम है. The patient is negative or the patient is at no risk for periodontal disease. ठीक है? And अगर 2 lines आ जाए, that means active MMP8 levels are more than 20 nanogram per ml, and the kit is positive. The patient is either having active periodontal disease or he is at an increased risk for periodontal disease. So these are monoclonal antibody based kits, both of them. So we ran these in 102 cases, as I told earlier. 72 were the control group. So this is the results, males, females, comorbidities, and this is the periodontal status of those of the population. Similarly for the control group. And after running the kits, we found that in the controls, first of all, in the controls, the kits were running true to their sensitivity, 84.62% sensitive aa gayi thi kits. But for the COVID-19 patients, the sensitivity had slightly reduced. Few of the COVID positive patients, few of the patients who were not having periodontal disease were also testing positive. Now, why was this happening? This was happening because COVID-19 में there is cytokine storm. तो cytokine storm में MAP8 level भी increased है ना? तो कई patients जिनमें periodontal disease नहीं भी है, उनमें भी kits were testing positive, but still overall sensitivity of the kits remained above 80%. So by this study, we could conclude that these point of care diagnostic kits are user-friendly, objective, we can use them to increase the awareness of periodontal disease among the individuals and alarm them to seek oral care before periodontal disease has progressed to a severe stage. And they can be used as screening tools by any medical, paramedical professionals, and even the layman. Sorry. Uh, Following this study, we have also conducted a study. Now, this study, we have done the stats. We are yet to write about it, where we had the opportunity to use SARS-CoV-2 antigen rapid test kits also. In this, we took the nasopharyngeal swabs of the patient, put the swab in this a well. There is a well here. इसको यहाँ पे card है ये, उसके अंदर डाला. Elution fluid दिया, यहाँ पे 5 drops डालना है. And उसके बाद ये टेप हटाकर, ये जो white color का टेप दिख रहा है, you stick the card. You tightly stick the card and keep it for 15 minutes. And similarly, is window ke andar you will get a single line if the patient is COVID negative and 2 lines if the patient is testing positive. So we had the opportunity to use these kits also in 100 patients. That is another study. Now, in the last, I'll like to talk about something about pre-procedural mouth rinses. So there have been a few studies conducted. Okay, dentistry hai, ab karna hai patient, asymptomatic bhi honge, patients are getting vaccinated also. So we need to safeguard ourselves. Okay, so different number of mouthwashes were tested, and it was seen which of them is more efficacious in reducing the viral load of this particular virus. So one of the studies, Yoon et al., published in 2020, they evaluated the viral RNA in nasopharyngeal swab, oropharyngeal swab, saliva, sputum, and urine of 2 patients in the hospitals from day 1 to day 9. And these patients were given chlorhexidine gluconate mouthwash for rinsing for 30 seconds on day 3 and day 6. And chlorhexidine mouthwash करने से पहले उन्होंने saliva level check किया virus का, and उसके बाद 1 hour के बाद, 2 hour के बाद, 4 hours के बाद check किया. Okay, then we did the RT-PCR. So they found that the viral load was highest naturally in the nasopharyngeal swabs, and it was remarkably high in the saliva also. As far as the mouthwash is concerned, there was a transient decrease. Chlorhexidine use करने से there was a transient decrease for 2 hours following the rinsing, but उसके बाद again the levels increased. So you can see यहाँ पे एक ऐसे transient increase है from 2 hours. 2 hours तक decreased रहा viral load, but 2 to 4 hours में again the viral load increased. So they concluded that chlorhexidine mouthwash is effective in reducing the viral load in saliva for short period of time. Then another study has tried to evaluate the efficacy of povidone iodine, chlorhexidine, and CPC in decreasing the viral load. So they had 16 patients in their group. 4 were recruited to the povidone iodine group, 6 for chlorhexidine, 4 for the CPC, and in 2 patients, water was used as the control. So सबको इन्होंने mouthwash करवाया, and they collected the saliva at baseline, 5 minutes, 3 hours, and 6 hours, and sent the saliva for RT-PCR. In them, they also found that again, chlorhexidine was least effective, naturally water, then uske baad chlorhexidine, then CPC, and then povidone iodine. So CPC was able to decrease the viral load within 5 minutes compared to water, but best was povidone iodine, and both povidone iodine and CPC decrease the salivary loads for as long as 6 hours following the mouth rinsing. So this was one of the first randomized clinical trials to examine the efficacy of commercial mouth rinses. And they also said that yes, naturally these mouth rinses can be as pre-procedural rinse. Now, this is the latest article which has been published in JADA just recently in the month of November. And this is the cover story also. So in this article by Chaudhary et al., they had recruited 201 asymptomatic, pre-symptomatic, post-symptomatic, and symptomatic people. And in the case group, they had 41 symptomatic patients. They instructed them to rinse with saline, 1% H2O2, and 0.12% chlorhexidine, or 0.5% povidone iodine for 60 seconds. And they have measured the viral loads at 15 minutes and at 45 minutes after the rinsing. So they found that all 4 mouthwashes decreased the viral load by 89%, 70% through 97%. extent of reduction correlated to the initial powder load. So mouth rinse is inefficacious means, especially the load is less than 10.
5 मिनट में तेरे को बोला एक वाटर
I'll come to it. With this,
जी
to
आपको भी जाने लगी
Kindly mute.
these times to come up with these researches. And our journey continues. We have not still stopped. We are working. As I presented this article right now, it is under review at CEDR. Toothbrush is under consideration at JCP. And this particular study has been accepted for publication at CEDR. And just lately, we have been granted 7.5 lakh rupees. We have collected the samples of GCF, saliva, and mouth rinse and blood of COVID-19 patients. We have fortunately, we have already collected the samples before the COVID-19 reduced. And we have received a grant of 7.5 lakhs to purchase 12 cytokines and chemokine cytokine bead array kits for flow cytometry for checking 12 cytokines and chemokines. And we are in the process of purchasing these kits. And whenever the study is complete, I'm sure I'll have the results and present it to you. Thank you so much. How do I stop sharing? Okay.
Thank you, Dr. Saab.
Thank you so much, Vivek. Thank you for having me.
Dr. Ruchi.
Thank you very much, ma'am, for such an interesting lecture. Now I would like to invite Dr. Pradeep Tandon, sir. Are you there, sir, with us? Dr. Pradeep Tandon, sir?
सर है नहीं, सर से अभी डिस्कनेक्ट हुए हैं अभी.
Okay. Yes, sir. We can see you, sir. Dr. Pradeep Tandon, sir?
डॉक्टर रुचि है नहीं वो सर.
We have Dr. Balaji, sir, also with us. Good morning, sir.
Dr. Vivek. Hi, good morning. Good morning.
Hello, sir. Hello, sir.
Yeah.
1 minute, sir. Sir, as far as I understand, Shipra is a pioneer in COVID studies in India.
Definitely.
And hats off to her for doing so much of work and putting our country at the forefront in Peru-COVID interrelationship.
Thank you, sir. Thank you so much.
Thank you. Thank you for a wonderful presentation, Dr. Shipra.
My pleasure, sir.
Now can
Thank
I
you.
invite Dr. Sachin Chawla, sir, to say say few words. I think
नहीं है
he's not.
डॉक्टर वंदना है. आई कैन सी डॉक्टर वंदना इज देयर. डॉक्टर वंदना भी नहीं है. आई गेस सब चले गए हैं डॉक्टर.
Chalo, now I would.
डॉक्टर गुरप्रीत
I
इज
would
देयर.
like to request Dr. Pradeep, sir. We can see you. Can you hear us? We would like to have few words from you. Sure. Okay, let's move on. Now I would like to request Dr. Vivek Ben, sir, Professor and Head, Department of Periodontology, Saraswati Dental College, to give some vote of thanks and present ma'am with the certificate of appreciation.
First of all, thank you, Dr. Shipra, for giving us time. And I'm also thankful to various faculty members. We had Dr. Sanjay Gupta with us, Dr. Vanna Pant with us, Dr. Manohar with us, Dr. Sachin Chawla, my old friend, Dr. Pradeep Tandon with us, Dr. Gurpreet with us. So I'm thankful to everyone to find time. And Dr. Shipra, thank you very much for discussing your work with us. And I can tell you, it was very. I don't have words. When I listen you, there's so many things, so many. We all were actually going through this phase, and only you were the person in this country, I guess, that who could find the relationship and perform so much studies. Thank you very much, Dr. Saab. And let me do it. Dr. Shipra,
Anji.
can we have some PDF of your articles, if it is possible for us, that are online available?
नहीं नहीं क्या चाहिए आपको? You need the details.
The review articles that you publish about MMP and
Sure, I'll mail them to you, Dr. Vivek. And I could see in the chat box somebody was asking for my phone number, so you can share with them. And my email ID was also there at the bottom of each PPT. It is shipra1472@gmail.com. So anybody has any doubts, any questions, I will be most happy to answer them.
जी डॉक्टर साहब ठीक है. Thank you very much, Dr. Saab. And जी.
Published papers, not an issue.
Dr. Pradeep sir has joined. Sir, are you there?
Yeah, I'm there.
Yes, sir, we can hear you.
जी sir, please sir.
You can hear my voice?
जी sir, बिल्कुल sir.
Dr. Dubey, thank you very much for your speaking. Actually, we are organizing here in our hometown a conference on all the dental doctors as well as all the medical persons who are focusing on the COVID problem mainly. Because of the last 2 years, we could not conduct a common platform to raise on any scientific topic because of the COVID. So your topic, your deliberation will help us a lot. Thank you so much. Thank you so much.
Thank you, sir.
Thank you, Dr. Shipra. And this is a certificate for you for excellent deliberation. Thank you, Dr. Saab. Can you see the certificate of appreciation? Thank you very much, Doctor. We will mail you this certificate on your email ID. And I'm thankful to all the audience for attending this program and listening Dr. Shipra and making this program a success. जी डॉक्टर साहब कुछ कह रहे थे, please.
Somebody is again asking for my email and this phone number, so kindly share with them. Yeah. And whatever they will answer, not an issue.
ठीक है. If they ask us, we will send them, Doctor. No issue.
Thank you, Dr. Saab. Thank you for having me here. It's a great honor.
Thank you, Dr. Saab. Thank you very much. Thanks a lot.
Thank you, one and all. You all may leave. Okay.